Hi everybody, I'm Russell Westacott, the CEO of Seniors' Rights Service, and welcome to the 2020 webinar for World Elder Abuse Awareness Day. Obviously, with COVID-19, we would usually have a get-together and have some people here in the room, but today we're strictly doing this by webinar. Before commencing, I'd like to acknowledge the traditional owners of the lands in which we meet, the Gadigal people of the Eora Nation, and also acknowledge the different countries and lands across New South Wales in which we work, Seniors' Rights Service being a state-based organisation, and also our colleagues working in on other lands across the country. With me today, we have Margaret Crothers. Margaret is the Regional Coordinator of our Aged Care Advocacy Services, and Margaret manages a team of people who work in regional towns across New South Wales, delivering services around aged care. Just a little bit of background about Seniors' Rights Service and who we are. Seniors' Rights Service is a community legal centre. We provide free and confidential legal services to 3,500 people a year. We also are an aged care advocacy provider, which means that recipients of aged care in New South Wales, if they aren't happy with their service for some reason, they can call our number and we can advocate on their behalf or with them, or perhaps with their family member, to ensure that their aged care service is optimised. And then the final thing we do is to travel the state and raise awareness around a range of issues, the rights of older people. In the financial year, a year ago, we haven't finished our stats for the year that's finishing now, but we did over 1,000 events across New South Wales that 34,000 people turned up to. So again, legal services, aged care advocacy services, where 4,500 people last year used our aged care advocacy services and our education and information services. I just want to give you a little bit of context about elder abuse, because I think it's important for all of us to understand the scale of the issue. In New South Wales, there are 1.5 million older people. Australia currently doesn't have a prevalence study on elder abuse, although many social researchers in Australia think that elder abuse occurs in around 10% of the population of older people. So in the New South Wales context, 1.5 million older people, 10% of them being affected by elder abuse, that means there's 150,000 people who are victims of elder abuse across our state. And one of the challenges around elder abuse and getting support and seeking services is that elder abuse is a silent epidemic. Because the perpetrators of abuse are often family members, the older person is very reluctant to talk about the abuse because they may be ashamed. Again, it's stigmatized, it's not talked about a lot within community. So one of the best things that I personally recommend to older people who are either being abused or feel uncomfortable about a situation and being coerced or pressured is to try and maybe reach out to a friend or perhaps a neighbour. And we will be talking about various 1-800 numbers that people can call through this webinar. But I just encourage people to start that conversation. And it just might be a conversation with somebody that you have confidence in. And even by having that conversation with somebody that you trust, the issue may well get resolved because that person may well be able to help you manage how to get through this situation. Then again, you might talk to another person and be decided that somebody calls for one of the services that we'll talk about later today. So there are many organisations across New South Wales Seniors' Rights Service works in partnership and collaboration with dozens and dozens of organisations right across the state. And we see ourselves as an organisation priding ourselves on working in partnership and collaboration because, as I said earlier, with 150,000 people who are victims of elder abuse, it takes more than one organisation to be able to offer that type of support. So with that, I'm going to hand it over to our first speaker. We have, as I said, Marg Crothers is here with me today. The two speakers coming up are the Honourable Jeff Lee, who is the New South Wales Minister for Seniors. And also after that, we have the Honourable Dr. Kay Patterson, who's the Age Discrimination Commissioner. And both of them will be giving a short presentation. And then we'll come back and Marg and I will have a bit of a chat. Thank you, everybody.
Today, on World Elder Abuse Awareness Day, the message from the New South Wales Government is loud and clear. The physical, emotional and financial abuse and neglect must stop. Every older person in New South Wales deserves respect and should not be taken advantage of. It's important that as a community, we remain connected with older people, particularly if they're more vulnerable and rely upon others for support. By keeping in touch, we can then take action if we see something is not quite right. For example, you may notice that their living arrangements have suddenly changed, or they start to avoid social gatherings. At the same time, older people must know it is not okay to be told by someone how to spend their money. It is not okay to be told that they can't see their family and friends. Seniors have the right to make their own decision about their lives. Today, I'm honoured to be part of the launch of the Seniors' Rights Service new strategic plan for 2020 to 2024. The Seniors' Rights Service performs an essential role in protecting and advocating for older people in New South Wales. The new plan includes important measures to educate seniors about their rights and how to access support available to them. The Senior Rights Service is one of the many organisations we are consulting with to develop the next New South Wales Government strategy for seniors. The new strategy will build upon our existing work to enhance the lives and well-being of older people in our state. It will address the current needs of seniors, as well as the new and emerging issues expected to affect them in the future. I look forward to continuing our productive partnership with the Seniors' Rights Service and congratulate them on the launch of their new plan. I also want to highlight several resources that aim to reduce elder abuse in New South Wales. Elder abuse has no place in our society. It is everybody's job to recognise the signs and take action. If you're an older person experiencing abuse or you suspect abuse of an older person, I urge you to contact the Ageing and Disability Abuse Hotline on 1-800-628-221. Together, we can stop elder abuse. Thank you.
So thank you so much, Minister Lee. Thanks for your contribution and launching our new 4-year strategic plan. The plan can be found on our website. While it has a very ambitious agenda for the next 4 years, the strategic plan, some of the key features are working with people from diverse backgrounds and diverse communities, but also working in partnership and collaboration with organisations across New South Wales, whether they be community-based organisations or indeed arms of government such as the New South Wales Ageing and Disability Commission that the Minister just spoke of, and also working in rural and regional and remote New South Wales. And Marg and I will talk a little bit about that after we hear from Kay Patterson. So we'll take it over now to Dr. Kay Patterson who is the Age Discrimination Commissioner at the Australian Human Rights Commission. Thank you.
I'm sorry I can't be with you in person, but you'll understand I'm locked in down in Melbourne. But I'd like to thank Seniors Rights Service New South Wales, and in particular Russell Westacott, for inviting me to participate in this online WeAd event. As Age Discrimination Commissioner, I've chosen, as you know, many of you, 3 key priority areas on which to focus: older women's risk of homelessness, age discrimination in the workplace, and elder abuse. We are gathering, or we're virtually gathering today, for World Elder Abuse Awareness Day to spread the message about elder abuse. I've been asked to speak about ageism, and in particular, strategies for countering ageism. Elder abuse is an extreme expression of ageism resulting in harm. This may be physical, financial, psychological, sexual, or sadly, even neglect. I recently came across a report by the UK Centre for Ageing Better, entitled Doddery but Dear, examining age-related stereotypes. I mention this because it contains one of the best definitions of ageism I've come across, and I've had an active interest in this area for many decades. And I quote, "Ageism is a combination of how we think about age, stereotypes, how we feel about age, prejudice, and how we behave in relation to age, discrimination." An example of ageism relevant to elder abuse is where attitudes tip the scale towards protection rather than respecting an older person's autonomy. Benevolent ageism is an extension of ageist views about the independence and agency of older people. When taken to an extreme, these attitudes can result in elder abuse. For example, limiting an older person's social interactions or activities due to concerns about risk. I've often said, I don't think they're going to do that to me, and I'm sure a lot of the baby boomers aren't going to tolerate it. But whether it's in the current COVID-19 context or during normal times, that benevolence can actually lead to a form of abuse. I was concerned to read recent media reports of cases where physical distancing regulations have been used by relatives or older people and others as a reason for isolating them. For instance, the Caxton Legal Service in Queensland reported a case of an older client being denied access to her husband, who was being cared for by a daughter, on the grounds of social distancing. During a recent OPAN webinar, Jenny Blakely, who is the manager of Seniors Rights Victoria, cited examples of older people moving into homes of their children under the guise that they will look after them during the pandemic, only for them to find that they are being shut away by their family, forced to live, eat and sleep in one room. There was even a case where the older person was moved into the child's backyard shed. In the current context, when we have all been in this together and gone through periods of physical distancing to limit the spread of COVID-19, concerns have been raised by those advocating the prevention and those supporting people experiencing elder abuse, have real concerns that older people may be at heightened risk of elder abuse due to being at home for extended periods with the perpetrator, not coming into contact with others such as allied health professionals, hairdressers or pharmacists who are in a position of being community responders to the red flags for elder abuse. They may have perpetrators experiencing stress, anxiety, financial pressure resulting from job or business loss or reduced work hours, thereby enhancing the pressures that are the drivers of elder abuse. This brings me to the importance of maintaining social connections in whatever way we can as we respond to these challenging times. This includes connecting with people outside our own generation. There are strategies for countering ageism. For example, we know that programs and relationships which foster positive intergenerational experiences and connections are one of the best ways to reduce ageist attitudes. Last year, a team of researchers led by Cornell University published a study in the American Journal of Public Health, outlining the negative effects of older people adopting society's negative attitudes towards ageing. As a result, the older people were more likely to experience physical illness and psychological distress, and they lost, on average, 7.5 years in lifespan compared to people with a more positive outlook on ageing. The Cornell study found that intergenerational projects combined with education were successful at countering and reducing ageism. There are many intergenerational projects fostering communication and relationship building across generations to reduce ageist stereotypes. For example, last year I was involved in a panel on the ABC TV program Old People's Home for 4-year-olds. If you missed this magical program, it brought preschoolers and people living in residential aged care in Sydney, in the northern suburbs of Sydney, together on a regular basis for activities that built intergenerational connections. This had positive effects on both the physical and mental well-being of the older participants and children who developed relationships with them. Many are still keeping in contact with each other. The response to this program was overwhelmingly positive. It led to a surge in interest on behalf of playgroups, preschools, kindergartens and residential aged care to create intergenerational activities. If you can, and you haven't seen it, catch it on ABC iView. It's worth watching. While such programs are not possible in the current context of COVID-19, we can all think about practical ways we can foster intergenerational relationships in our own lives. Some ideas include keeping in touch with older people we know who are at risk of social isolation by phoning or using social media apps or a visit, making sure we follow any distancing regulations that apply in your state or territory, and checking as these continue to change. Checking in on an older person and those who are at particular risk in our community, a family, friends and neighbours. This will have the important effect of reducing social isolation and loneliness, which in turn are factors that heighten the risk of elder abuse. My message throughout the pandemic continues to be one of solidarity. While this we add, we cannot be together physically, we need to focus on how those of us working on elder abuse advocacy, prevention and support can still work together to get the message out so that older Australians know they are not alone at this challenging time. When it comes to ageism, to paraphrase Eleanor Roosevelt's quote, "No one can make you feel inferior without your consent, and no one can make you feel old without your consent." We should not stand by and allow others around us to be ageist, nor can those of us who are older adopt ageism for ourselves, with all the negative consequences that entails. This is why we need to call out ageism wherever we see or experience it. We also need to find opportunities in our everyday lives to connect with people from different generations. We all need to stand up and be counted and celebrate the contributions of older people. Just think of the older people still in the workforce, all the grandparents caring for grandchildren, the army of older volunteers, and where would the community organisations be without the contribution of older people? Thanks to all of you participating today for your commitment to combating elder abuse. I'd just like to end by reminding you we now have a national elder helpline, which redirects to the caller's state or territory. 1-800-ELDER-HELP, 1-800-353-374.
So thank you very much, Dr. Patterson, Age Discrimination Commissioner. And again, thank you to New South Wales Minister Lee for both of those presentations. I just wanted to make the point, there were a couple of 1-800 numbers that were discussed in both of those presentations. So we're just putting two 1-800 numbers up here. Now, the 1-800 number at the top of the screen is the national 1-800 number for elder abuse helplines across Australia. And if you call that number, that will still be diverted to the 1-800 number that Minister Lee in New South Wales talked about at the end of his speech. And of course, Seniors' Rights Service, a community-based organisation, we're a statewide organisation. Our 1-800 number is there on the bottom half of that screen. So, and remember, Seniors' Rights Service, we provide free and confidential legal services, aged care advocacy services for recipients of aged care in New South Wales, and we try to raise the awareness of the rights of older people and therefore reduce the risk of elder abuse. And like I was saying before, we travel the state. We have many different events going on all the time. Of course, that's been restricted with COVID-19, but we're looking at building a lot more web-based content and some other digital content that can get the message out there. So now with me, I have Margaret Crothers, and Margaret is the regional coordinator for the Seniors' Rights Service Aged Care Advocates in regional New South Wales. And Margaret, it's been a bit of a growing field with setting up new regional advocates in New South Wales. And I've got to say I'm a little behind the 8 ball on exactly how many we've got out right now. Can you let us know?
1, 2, 3, 4, 5, 6 of us now. So.
Okay, great. So there's 6 of us. So that's really happened just in the last few years, and particularly based in Lismore, Dubbo, Wagga, and down the south coast, as well as the mid-north coast up at Port Macquarie. And some of those advocates are working part-time, which is why there's others who are filling in on the other part-time hours. I actually wanted to put a question to Margaret because we heard from both the Minister and we heard from Kay, and we heard those 1-800 numbers that people can phone for assistance. But we know, as I was saying earlier, that elder abuse, there's a lot of stigma and a lot of silence about elder abuse, and sometimes people don't want to call organisations. But I just wanted to get a bit of a sense from Marg in regional areas, particularly where it might be fair to say that that people are more concerned about their anonymity. I can never quite say that word right, but to ensure that if they do go forward or speak to somebody, how you might work with them, and also when the person gives permission, how you actually involve other organisations to ensure that somebody who is presenting with an elder abuse issue or issues, how we can best respond to that person and tailor a response to their particular needs. Margaret.
Okay, thanks, Russell. And that's a very good question. And basically, that's how we operate in the regions. It's very important that we do collaborate, and collaboration is the key aspect to the work that we do. You could probably look at it in 2 major areas, which is prevention and responding to the abuse. I think everyone by now knows what abuse looks like. We've done that plenty of times. And the questions that I get all the time are, how do we prevent it, or how do we respond? And so that's what we're going to look at today. We'll also finish with just a few other contacts, people that we use, people that you can use to try and abate any elder abuse. So there are our key areas. I'll start with the prevention, and I think that's probably one of the most important things. Unfortunately, I don't have any big sticks to offer you. There's nothing, no one particular way that we work. There's no one particular answer. There's not just one number that we have to call. And if there's one thing that the COVID and the bushfires have taught us, is that most of us don't do very well when we are isolated, when we're alone. It is a real issue that we have to address. And so working collaboratively with the services in the regions or within each particular area is very important to us, and it's the way we work. It's the way we do everything. I had a call just on Friday from someone down on the South Coast. It was an aged care provider. She was concerned about a particular person who'd come into her area. She was worried about their isolation. She was worried about their potential for an abusive situation. And so we had a chat. She talked about what she had done to try and put in measures. We looked at possible other strategies, and then I offered a bit of advice and a bit of assistance from a Seniors' Rights Service, how we could work together. And at the end of the conversation, she indicated to me she was very happy, the fact that she had someone to talk to, that she had also been able to look at collaboration, and there were a few things that she hadn't thought of and a few other groups that she hadn't thought of collaborating with. And when I hung up, I thought, there's my example for Monday. You know, it was a classic example of people working together, people collaborating. And so that's a really important aspect of preventing elder abuse. But I think one of the other things that we really need to look at is just getting out there I spoke earlier about the problems with isolation and the frailties of older people who are isolated, and how vulnerable they are to abuse if they are isolated. And certainly one of our key targets for this year has been, in the last couple of years, has been getting out there and reaching the frail, isolated people. And something that we have done and we have initiated, and thank you for the funds to be able to do that, has been something that's unique to our service, and that is an InfoBingo session. We call it InfoBingo because basically we play bingo, and come on, everyone knows you do like bingo. People scoff at it, but it's fun. And what we do is we use a modified version of InfoBingo, just a shorter version. We intersperse that with skits, games, competitions, quizzes, and the whole premise of the event, and it goes for quite a few hours, and there's lots and lots of prizes, mainly chocolate, and we also provide lunch. So it's an incentive for people to come in. We target the isolated people, but basically what we're doing at the same time as entertaining people and making it fun, we're actually informing them. As a retired school teacher, I think education is power. Wisdom is strength, whichever way you want to look at it. And I suppose at the end of the day, after discussing things like power of attorney, scams, enduring guardianship, people's rights, at the end of the day, we send people home with a bag that's full of information about services that are available, services that are accessible in that particular area. If you're like me and you forget half of everything you're told in one day, but you've forgotten it by the next day, this resource is very important for older people, because they may not want to think about it on the day, but actually by the next day or days after, they can go and look at that information that we have provided to them. The other thing that's important about the day is that people get out and socialise. Remember, we targeted people who were isolated, and the feedback has been absolutely fantastic with these events. People come up to us and say they've met people that they've never met before. They've made friends. They've found out about organisations, places that they can go. And probably more importantly, people have come up to us and said, we were worried about a neighbour or a friend or someone down the street, but now we know who to go to, who to contact. And that's really, really important as well. So, you know, the InfoBingo has been very successful for us. We've had numbers in excess of 100 at major events around the state. I think the collective blood sugars go up after each event because we give away so many chocolates as prizes. But the whole point of the event is that people have fun and they learn at the same time.
Yep.
Another area that I think is very important where we work collaboratively is just in how we respond. And I alluded to this earlier with the Bega example, is that we respond better as groups if we work together. So I suppose the worst thing in responding to elder abuse is to do absolutely nothing. And if there is an avenue, if there is a place where you can go to, somewhere where you can share information, somewhere where you can share knowledge, where you can share services, then this is the way to do it. Don't ever assume that you're the only one responsible. and certainly work together collaboratively. And if you're just in the community, you could help someone by responding by just being a support to them. You don't have to be an organisation. You don't have to work in aged care. You don't have to be a carers group or anything like that. But you can just offer information. You can offer help. And by just tuning in today, you obviously are interested in helping and responding when it comes to elder abuse. And you can do that by just supporting and providing information. We do come across a number of elderly people who do want to, maybe they talk to you about elder abuse, but they're not too sure about how they should respond, or they just don't want to respond. They know they're being abused. They know they're in a situation. In that sort of example, we can't force people. You cannot force people to take action for reasons known to themselves. They may, for example, decide that they stay in an abusive situation because that's all they've got. They may be losing access to their grandchildren. They may have the only carer is also the abuser. So in those particular instances, you can't just boot stomp your way into the situation and go, oh yes, we've got the answer. What you do need to do is just to think, support, and just offer assistance. Offer that person a way out, offer them the services that are available in your area, and then leave it with them. Obviously, be careful, be aware of being safe. It's not a very good idea to leave a brochure out in an abusive household if the abuser is going to find the brochure, but do it thoughtfully. And if you don't think that you can help that person, certainly go and seek assistance. You've got our 1-800 number. You've got people in your local area who may know how to respond. And I think this is, once again, collaboration. Well, I know we're using that word repetitively, but collaboration is really, really important.
So we're just putting some numbers up before we head to questions. So the numbers on the screen right now are what I was talking about earlier. So that National Elder Abuse Helpline number will divert to the helpline in your state. And in New South Wales, it's the New South Wales and Ageing Commission. And that commission's a relatively new entity, about a year old. 1-800 Elder Help will divert to the commission in New South Wales. And then for Seniors' Rights Service, our 1-800 number there on the lower half of the screen. And then we're going to put up some websites that might be useful for people to look around. So we've got the Age Crime Prevention Officers from New South Wales Police. Our organisation does a lot of work with New South Wales Police. Also, as I was talking about before, the fairly new New South Wales Ageing and Disability Commission. Their website is up there. That commission is an excellent resource for older residents in New South Wales. And it's an organisation that we refer to in some cases where the matter might be too complex for us as a community-based organisation to assist with. EAAA stands for Elder Abuse Action Australia. They have a new knowledge hub that has just been a soft launch. It's going to be officially launched at some point in the next coming months. But that knowledge hub, there's more and more information going up there from all the different organisations that Marg was talking about from all the states and territories around Australia. So compass.info, it's a great resource for people. Community legal centres are in every state and territory, and they're right across New South Wales. There's about 40 of them. Seniors' Rights Service, obviously being a community legal centre with a statewide remit for older people, but there are local community legal centres. And of course, we'd like to make mention of Relationships Australia, who are a vital resource, particularly with family issues.
Yeah. One thing with when it comes to Relationships Australia, I spoke earlier about people who may be reluctant to take any action. Relationships Australia is a good referral because sometimes they will mediate or provide counselling for some people who are reluctant to take action. So it's a good thing to have in your toolkit when it comes to dealing with elderly people and responding to potential abuse or abuse in itself. So that's why we've got it on there.
Yeah. Great, thanks. So we've got some questions that some people have sent through. Jane, would you
Two
like?
questions. The first one maybe for you, Russell, from Stephen Etkind. Can you define the term abuse and elder abuse? And if it is a clear term, can or should elder abuse be treated as a crime?
Thank you, Stephen. So elder abuse can be an extremely subtle thing that occurs, or it can be something that's very obvious. And I'll give you some examples. For example, a neighbour might ask on pension day to the older person living next door, give me $200 and I'll go down and do your grocery shopping for you. They may go down and do the grocery shopping and only bring back $150 worth of groceries and no receipt. And when this happens over time, obviously it ends up amounting to quite a sum of money. We have people calling us in those situations. It's not uncommon, believe it or not. It's actually quite a common issue. Or it might be a family member doing the shopping, by the way, not just a neighbour. And by the time the older person calls us, it's very difficult for us to trace back and to understand how much money had been handed over and how much how many goods and services were purchased with that money. So it's very important to insist on receipts. And even if a little strategy that I give about writing things down, even just on the back of an envelope, quite literally, at least there's something in writing that on a weekly basis or a fortnightly basis, I'm giving this person $200 or whatever it might be. I'll just go into family agreements as well, because that's another thing that very few people actually put in writing. So the granny flat arrangement down the backyard or a spare room under the house, encouragement by the adult children to have mum or dad move into the downstairs room. Mum or dad sells the original family house to help pay the mortgage of the adult children. And then suddenly there's a breakdown in relationship and the older person has to move out. But while there might have been discussion about how the arrangement would take shape in the first place, nothing was put in writing. And again, it's very difficult to understand what the rights of the older person is, and also how much money the older person is entitled to. So we encourage, when people are entering into agreements like that, even with family members, to try and put something in writing, and so that then there's an opportunity for us, if legal action needs to be taken, that we would refer the matter to either the police or, in fact, we would refer the matter to the new New South Wales and Disability Commissioner, who also has investigative powers and may be able to do some more investigation than what our organisation can do. So, in short, there are many aspects of elder abuse that is illegal, particularly when you're trying to benefit from the finances of an older person, and that benefit is for you and not for the older person themselves. Jane, did you want to give another question?
There's another question's come in about capacity. It can be difficult for family members with power of attorney trying to help manage the elders' financial matters as best as possible, especially if they have dementia. That's just a comment. Maybe you'd like to quickly address that.
Yes, look, I just agree with that comment. I think that there are some challenges and difficulties around that, and particularly with people losing capacity. But obviously, it's again goes back to the issue of ensuring that you have doctors and medico people who have actually put things in writing, so that if you're acting as power of attorney with your mother or your father, that you are doing it with the knowledge that the medical advice being given to you and your family, and in fact to the older person, the mother or father, is in writing, and that allows the person who is operating as power of attorney, gives them some a safer legal ground to stand on. Mark, did you want to?
If I could just add to that, Seniors Rights Service in collaboration in the Northern Rivers is doing some excellent work in looking at how organisations involved in enduring power of attorney and making those decisions and assessments, how they work together to protect the rights of the older person who is losing capacity, because capacity just isn't black and white; it's elastic, and so the key issue here is always consulting the older person to give them as much say as possible, because there's a bit of a common misconception, you could say, that an enduring power of attorney or an enduring guardian has total control over the older person, and that's wrong. Basically what you're meant to be doing is acting in the way that they would want you to, and the way they would have themselves. And so by putting together this, it's basically a group of people in the Northern Rivers, a group of organisations who are saying, let's try and protect and let's work in the best way that looks after the rights of the older person. And that's excellent work. And if that works up there, we'll be looking at expanding it around the state and implementing it as much as possible. And it comes back to, with all of these decisions about capacity, that is organisations working together to make sure that the older person's information, the older person's rights, the older person's wishes, and aged care, the whole lot, we're going towards that.
Yep.
Consumer-directed care, the quality standards is including the older person so that their rights are respected and their wishes are understood.
Yeah. Okay, we're actually at about 11:45. But one more question.
This has come from another source. If an organisation wants InfoBingo, how can they do that?
Oh, good question. Basically, what we've done we've worked collaboratively all around the state, community legal centres, Relationships Australia, local councils. So if you want to know how to run them, because they go for about 4 hours, so they're not just simple things, please give us a call, ask to speak to me, and I will fill in half a day for you by giving you all the information that you need. And certainly we're looking at putting something up on our website as well in our toolkit, education toolkit as to how to run them, but it's something we're working on. But certainly just give us a call, ask to speak to me, and I'll run you through how to do it. Thank you, Jane. It's a good question.
And I would just like to finish by making the point that on the Seniors Rights Service homepage, there's a bright yellow box called the Education Toolbox, and we've included in there some more recent issues around COVID-19, but we're amassing a larger field of videos, more interactive type things, and it can all be found on our homepage quite easily. Just look for the bright yellow tab, and you'll see a lot of online material there. And we will be building on that, like I said, and that will complement when we go out on the road eventually, hopefully later this year. So we're going to wrap today up. We were slated for 45 minutes. I think we've gone just a little bit over. And I know that a lot of people have other webinars that seem to be going on the hour throughout today. So we're going to wrap things up here and thank everybody for tuning in. And if you are indeed going to a 12 o'clock webinar, you'll have some time to make a cup of tea in between. But thanks for tuning in. We've had about at least 140 people on our live feed here. And obviously this will be put up onto our website for others to look at. So thanks so much. And please continue to support our organisation or make contact with our organisation if you need any access to our services. Thanks so much. All the best.